Good morning, everybody. Today we're here for another session, and today we will be discussing LALD, which is an ultra-rare liver disease with children. Today we have here with us Eduardo Lopez. He's 55 years old. He was born in Madrid and lives in Barcelona. He's an engineer and working in Spain. And today he is a father of a daughter that's affected by LALD. She was diagnosed in 2014 after 3 years looking for the diagnosis. It was a tough time due to the lack of information about the disease. But after she was diagnosed, she would have thought she would have to be transplanted when she was 7. Finally, thanks to the clinical trial that she was part of, the disease is progressing very slowly. Trying to look for other patients across Europe, but Eduardo organized a new organization specifically for LALD in Spain. He's trying to connect with other families to support them and spread information about the disease and improve the quality of life, and to find a final cure for LALD. Thank you for being here today with us. Eduardo, thank you for your time. We really appreciate it. And I know that you support ELPA and everywhere you can as part of the Rare Disease Working Group as well. So I'd like to start with you and ask you a few questions about the disease and what it's like to have a child with a ultra-rare liver disease.
Okay. Good morning, Cindy. Thank you very much for your introduction. You have explained really very well our personal story. And I'm going to explain you a little more details about this story. When you have a child who suffers a rare disease, immediately your life is changing completely. Just only in our case, we detected something with Martina. Martina is our daughter, and we detected something when she was only 3 years old. And from that moment till the final diagnosis, we spend a lot of time looking for the diagnosis, because ultra-rare disease are really very acknowledged by physicians, and you cannot find the correct hospital where you can get the final diagnosis about your child. That means when you are feeling that something wrong is happening with your child, immediately you started to look for the way, started to look for the diagnosis, and at that moment your life changed completely. Why? Because you have to adapt your daily life to the new situation. That means, for example, in my case, I spent 3 years traveling from Barcelona to Madrid during the clinical trial, and I lost 2 Mondays by month of my job. And I was talking with my company, and I negotiated with the company these holidays and vacations in order to take care of my daughter. This is part of the life that you have when you have this type of rare disease in your home with a child, especially with a child, because sometimes they cannot understand anything about what is happening. You have to go to the hospital, you have to go to different physicians, and the child cannot understand what is happening because they are only 5 or 6 or 7 years old. And this is the reality of the families. Immediately they have to change their life, and they have to learn about the disease. When you get the diagnosis, you have to learn about the disease, because it's not easy to find information about ultra-rare diseases. As I mentioned before, sometimes you don't have information, or too much information, from physicians, because they don't know ultra-rare diseases. You have to look for the best hospital. You have to talk with different physicians to look for the best professional in order to take care of your child. That means that you have 2 important steps in your life. One of them is you have to change completely your life. You have to focus your main target in your life around your child and look for the diagnosis. And the second step is when you have the diagnosis, immediately you have to learn. You have to learn about the disease. You have to look for other families. You have to look for patient organizations, because the patient organizations are the key to support you and your family. And these are the 3 main pillars of change in your life: your work, your new life around hospital and physicians, learning about the disease and try to create a network around you in order to protect your family. This is the situation that we are living.
What about psychological help for your daughter and other things for you? Social work help, also help, economic help. What happens with that?
Yeah, this is a weak point. That means when you get the diagnosis, you are suffering a lot, because always the diagnosis is not good. Finally, you got it, but at the same time, you cannot see the final of the tunnel. You are looking everything dark around you, and you don't have any, you are not going to receive any psychological support. You are not going to receive any social or economic support. That means physicians, they are going to take care of your child. Physicians, they are going to do the best in order to go to the hospital and to treat your child. But you need some support, psychological support. You need some type of economic support, because if you have to travel to different cities, as we did in the past, from Barcelona to Madrid, you have to spend money, you have to spend time, you have to look for hotels and also train tickets. You have to invest money. That's the reality. And at the same time, you need some type of psychological support. You need to look for families. You need to look for families, because sometimes you need to talk to other people that they are suffering the same rare disease or similar rare diseases. Why? Because they are going to explain you their trip. They are going to explain you how their child grew up and how the rare disease was developed or evolved in their personal cases. You need this type of information. This is the best psychological support. That means the best psychological support that you are going to receive is coming from other families. It's coming from some institutions, some patient organizations that they can take care of you. Of course, you can visit some psychologists, but you cannot find too many psychologists that they are experts about rare diseases. The best psychological support is coming from patient organizations and other families. And in case of the economic support, in that case, at least here in Spain, you are not going to receive any economic support. You have to support your own situation by your own resources. Only in extreme cases, the Spanish government can support you with some type of grant, but it's not part of the rare disease framework in Spain and also in Europe. The public authorities and the governments, they are looking for how to get you the diagnosis, how to treat your child, but they are not thinking about your psychological impact, and they are not thinking about how to support these families with some type of economic support. They don't think about this. For them, they are focused only in the treatment, of course, in the diagnosis, but that's all. And as you mentioned, Cindy, it's not only the diagnosis and the treatment. It's also very important, the psychological support and economic support for the families. Totally agree with you. Yeah.
What about family relations, your friends? How do they accept it? How do they understand the fact that you don't live a normal life, that you have to focus yourself on certain things at certain times that are not accepted socially by friends, family members, when they want to celebrate things and things like this, and you can't be part of it? How do you explain this to them? How do they accept it? How do they react?
Sorry, because I forgot that, as you mentioned, families and friends are much more important than other families that they are suffering the same rare diseases. You are correct. When you receive the diagnosis, immediately you are going to explain the situation to your family and your friends. Is the first step before to look for other families or patient organizations. The first step is try to explain the situation to your family. And sometimes they can understand, sometimes they cannot understand really very well what is happening, especially when you are talking about ultra rare diseases. Why? Because the majority of these ultra rare diseases are genetic diseases. That means sometimes you have to explain to your family that we have a problem with our genes. You know, in our case, we have a child, and we have to explain to our grandparents, for example, that this child is suffering this type of disease due to some genetic problem. The combination between the mother and father, this type of gene problem. And sometimes this part is not easy for understanding at the families, you know, because they cannot, if everything is fine, our life is fine, why we have this type of problem, why we have a genetic problem. Nobody can understand why. And we have to explain really very carefully. And the second point is, if you have some brother or some sister, you have to recommend to your brother and to your sister that they have to do some type of genetic analysis in order to avoid another case in your family, you know. And this is another important point with your family. You have to explain to your brother and to your sister, okay, go to the hospital, you have to do a genetic analysis about this gene or this gene in order to avoid another case in our family. This is also very important, the genetic advice, no? With in your family. And friends, the engagement from friends are, I think, are different, are totally different, because they are not going to be affected by a rare disease. The engagement from the friends are different. That means they are going to support you in order to spread out information about the rare disease, because one of the problems that we have with the ultra rare disease is that no information, few articles, and this type of network with your friends is really very useful, because sometimes a friend know another friend, and this friend know another friend, and if you have this problem in your family, my recommendation is try to get to your friends, try to explain to your friends what situation you are living at home. Why? Because they are going to help you. They are going to talk with other friends, and they are going to look for some type of support. Sometimes it's psychological support, but sometimes it's also some support from some physician or some doctor or some special hospital where they can take care of your child. This type of engagement is really very useful. And there is another important point. You have a child with an ultra rare disease, you have two different situations. One of them is when physically nobody can see the disease. For example, in case of the LALD, you can see the kids, you can see the children, but you cannot see anything outside. The disease is inside. It's affecting the liver, it's affecting the heart, different organs. Okay, of course, the main organ is the liver. And in that case, sometimes friends and family, they cannot understand why.
But you don't look sick.
Yeah, because they cannot see anything. They are looking at a normal child, but it's not true. For example, in our case, the accumulation of the fat at the liver is amazing, and my daughter, she cannot eat fat. And sometimes friends and family cannot understand. And when we have a birthday party, or we have some important party where you can eat chocolates, you can eat fat, you can eat different type of desserts, they cannot understand that my daughter Martina cannot eat, shouldn't eat. And but the families and the friends cannot see this, because they think, okay, but she has only high cholesterol levels. No. She has also fibrosis. She has also another problem in her liver. She couldn't eat fat. But in this type of parties, nobody can understand the situation, because they cannot see physically the effects of this disease in her body. This is one of the problems when you have this type of disease. Of course, if you have a different type of rare disease, where you can see the effect of the evolution of the rare disease physically, the people has a different engagement, has a different approach to the kid. In that case, sometimes sometimes no, sure, these kids are I don't know the English word, is estimation, you know, they are stigmatization, you know, people can see the effects of the disease in the body, and immediately they try to avoid any touch or any kiss, or
It's like when you have jaundice or something like that, that's something you can see.
And the point is, for the kids, this is terrible because they cannot understand what is happening. They are kids, they are children, and sometimes families and friends, in that case, they have to do an extra effort. They have to learn how to take care of this type of kids, how to kiss them, how to touch them. It's not easy for the families and the friends.
That's when you see the real friends, I think, the ones that stay with you, the ones that are there to help you. Yes,
totally
I agree with you
Cindy.
totally. And I know your daughter is an only child, okay, but there are families with siblings that also, like you said, that if they're not tested or until they're diagnosed, there are families that have more than one child with a rare disease. Have you seen anything like that with the LALD?
About the
Having more than one child with the disease in a family?
But
Have
you
you
are
come
talking,
across that?
but you are talking when they are receiving or they are in a clinical trial, or in no?
No, in general, if there's a family with more than one child with the disease, have come across that yet?
No, no, I don't remember that I could see this. No, I don't remember
But
this.
how do other people that you've seen with LLAD, do they still have other children, or they just decide not to have other children often?
But I couldn't understand really very well your question, Cindy, because the point is, if I can
Like what I said is, your daughter is the only child.
Is the only?
She's an only child. You don't have others. She doesn't have other siblings. There are no other children. You don't have any other children. You have one daughter.
No. It's the only one. You know why? Because it's a good question. We have this. We have only one. Why? Because when we after the diagnosis, we thought, okay, we are going to have another one, but we follow the genetic advice, and of course we try to use in vitro techniques. Because you cannot do. You have to go to the hospital and you have to do this type of therapies with in vitro, and finally we couldn't get a new pregnant. But for example, now in our case here in Spain, and also in North America, we have some families that they had more kids, and all of them, they are affected by LALD because they didn't get the diagnosis before to have the second children. This is important. This is an important problem in some families. Here we have one family in Madrid. They have 3, and all of them are a problem. No, but also in North America, we have a family that they have 4, and all of kids are affected by LALD. And the point was because they couldn't get the final diagnosis before to have the second and the third and the fourth kid. And this is terrible because finally you have 4 and all of them are affected by the disease. That's the reason, because to follow the genetic advice from your physician is fundamental, is the key. Don't have more kids before to do this type of don't have more kids if you cannot get the final genetic results. Because if not, you are going to have another problem, another kid with this type of disease.
I have another question for you also. What do you feel are the unmet needs for patients and families with the LLAD? What is needed for the patients, for their families surrounding them, other than social and economic help? Is there anything that you think to be done to help and with the unmet needs?
Okay, yeah, I think we have as a families, we are lucky families. You know why? Because in our case we have a treatment. Okay, that means this type of treatment can stop the evolution of the disease, but this orphan drug is the cost of this orphan drug is huge. is amazing. What happened with this? In Europe, some European governments, they are not covering and they are not supporting the families with this type of treatment, or they are treating some cases but not other cases. And this is not good. This is part of our mission as a family. We have to fight in order to get the treatment access to your kid from your government. This is really very important. This is one of the needs that we have as a families. And also we have to look for more families. Why? Because we don't have information about the evolution of the disease. That means the majority of the patients that we have are children. A few of the current patients are adults. That means we cannot see, we don't have a clear vision of the evolution of the disease. That's the reason because we are looking for more families, especially when we are talking about adults. Now we are detecting some adults that they are 60 years old, but we are finding this type of adults because they are suffering heart attacks, or they have a cirrhosis, and during their life nobody can diagnose their disease. Finally, they are getting the diagnosis due to some type of heart attack or some type of cirrhosis in their livers. That means we need to access to the treatment across Europe. We need to get more information and improve our knowledge about the evolution of this disease. And the third point for the families is to develop a research and development. And that means this disease is an ultra rare disease because the prevalence is not so high, but we think that it could be a disease that we could cure in the future, maybe with gene therapy or maybe with other type of drugs. And these three pillars, these three important points are the key at this moment for the families. Yeah.
I believe there's hope. I'd like, to you to explain to me, how do you foresee the future for LALD patients? What is your organization doing? Can you explain a little bit about your organization? We haven't really touched that today.
Okay. When we got the diagnosis for Martina in 2014, at that moment it was a big bit for us because we thought, okay, my God, we cannot see the future clearly, at that moment. But in October 2015, she was part of the international clinical trial. And at that moment we thought, okay, we have to look for more families. We have to look for other patients. Why? Because as I mentioned before, we needed some information, because in 2015, if you try to look for some information about LALD in internet, you couldn't find any reports, any publications, no information. And the few articles that we could find were related to Wolman disease. Wolman disease is the worst phenotype of this disease. It's the same disease, but in that case, babies cannot survive. And we thought, okay, we have to create a patient organization. I could check if we had some patient organization across Europe about LALD, and I couldn't find. I was talking with North American, with US, and I could find a patient organization called LALD Aware in North America. And I was talking to them, and I thought, okay, we have to do something. We have to try to create this type of patient organization with three missions. One of them was try to look for more families. Why? Not only for the improvement of the knowledge about the disease and the evolution of the disease, also in order to support these families, because we didn't want that other families could suffer as we suffer it. we thought, okay, let's try to look for more families. Let's try to talk each other. Let's try to support between us. Okay, it was the first mission. And finally, we found the Spanish patient organization for lysosomal acid lipase deficiency in 2015. And we started with our mission, look for more families and look for experts in hospitals. First of all, in Spain, it was our first step. Try to look for more people, more patients, and more hospital and expert physicians in Spain. And at that moment, in 2017, the clinical trial finished, and the drug was approved by the EMA, the European Medicine Agency. But the Spanish government didn't approve the reimbursement of this cost to the pharma company. And we found at that moment we found no future. Why? Because the clinical trial finished, and our kids, not only Martina, also the rest of the kids in Spain, they are not going, or they were going to receive the treatment. And immediately our patient organization was the tool to put pressure over the Spanish government and to get the final approval of the Canuma. Canuma is the name of the drug, of the Canuma, in order to be paid by the government. And thanks to this patient organization, we got it. That means our first step was to look for more families. Our second step was to get the treatment access free for the families paid by the Spanish government. And now, from the pandemic, we decided to look for more families across Europe and try to internationalize the patient organization with your support, ELPA support, and Eurordis, because Eurordis is the rare disease European patient organization. We try to, or we are trying to internationalize our patient organization, because we cannot find any European patient organization focused on LALD. And the point is now try to look for more families, thanks to your support, ELPA support. Why? Because we think that in other European countries, for example, in France or in Eastern countries, the government, they are not giving the access to Canuma free, or they are putting some barriers to the families in order to get the treatment. And we think that this should be the first step. And the second one should be research and development. We believe that that thanks to this type of networking with international patient organizations like ELPA, we can look for some research center or some physicians that they want to research about LALD and try to get some type of cure for the future. This is our story as a patient organization. Is only 7 years, because we found in 2015. Now we are going to celebrate the 8 years, but I believe that we can, all together, we can be stronger. Yeah, I think.
And what about future genetic treatment and things like that? What do you see something?
Yeah. Today she's 11 years old. She's going to be 12 in July. I practically have a teenager at home. She's happy, to be honest. She is happy, and the treatment is working well. When Martina was diagnosed in 2014, she had fibrosis, level 3, and today she is still in level 3. She couldn't recover the fibrosis, but the disease was stopped. That means the disease is under control thanks to the drugs. She is coming to the hospital twice by month. Of course, she has to go to the hospital several times by year for other type of clinical proof and tests, not only blood analysis, also resonance, ultrasounds, this type of medical tests in order to follow up the evolution of the disease. But to be honest, according to the information that we have today, the disease is stopped, or the evolution is really very slow. And now she is happy. And sometimes when I'm really very tired, because I have to combine my professional life with my personal life, and in my personal life, rare diseases are really very important. As I tell you always, is my hobby. Rare disease is my hobby today. Sometimes when I'm really very tired, she's telling me, Daddy, please help me. And I think, okay, it's really very valuable for me to support her. And to be honest, I have to say that thanks to Martina, thanks to my daughter, I am a better person, because before, to have this type of personal and familiar problem with the disease, I didn't have any idea about rare diseases. I didn't have any idea about hepatitis. I didn't take care anything about cancer. To be honest, I was very egoist guy. I was only.
No, you were a normal person. You were a normal person, and this is what people do. And when we start to take care of patients because we're involved in the diseases, I think it brings in a new light to us.
Yeah.
And it gives us a meaning to our life that didn't exist before.
Yeah.
It's very important, and this is what we're doing, and it makes us healthier. It makes our children healthier, and that's what we need to do.
Yeah.
And we hope that we'll have a brighter future. And with a cure for the disease, not just stopping the progression.
Yeah,
That's my big hope.
I totally agree with you, Cindy. Today I can say that I'm enjoying. I'm feeling better, and I am really very happy to support families and to help and give my free time to this mission. I'm really very happy, and I recommend to the people that they have to be more. They have to feel closer to the people that they are suffering, not only about rare diseases or other diseases, also about other important points that we can see in the life, the wars and the everything. We have to be more humans, and I think.
Sometimes difficulties in life teach us so much more than we expect. That's something that we have to remember. Yeah. Eduardo, I want to say thank you today for giving me your time. Thank you for all the help you give us with the working group. And I really hope that things will just be much brighter and happier, and that all the children will be healthy in the future. That's what we need.
Thank you for this interview, Cindy. I am really very, very proud to be here and to share my personal experience with you, and I'm happy to be part of the rare disease working group who you are leading. Thank you very much. Thank you very much.
Have a good day.
You too. Take care.
Bye-bye.
Bye-bye.